start to close out here, you know, the pandemic obviously has had a big impact on healthcare. Not only what we've experienced over the past 2 years that we've talked about, but it's going to have some longer lasting impacts. You know, I don't know how long, but no doubt we're going to see sort of the impacts of what we've experienced for a while. So if you would just sort of tell how you think the pandemic has changed healthcare, the landscape of healthcare in the long term.
Maybe not all good, but I think the trust-distrust relationship between the general public and healthcare workers, I think as a healthcare person, it makes me a little bit more sensitive to explaining the why and what for, and not just making the assumption that this is what I'm recommending, just roll with it. So to kind of meet in the middle on that is one. Two, I think some of the visitation policy stuff and the throughput of visitors in the hospital, that will have a permanent look on that and permanent changes on that. Hopefully we'll never have to ban visitors altogether, but the throughput being down, I think, is important in the hospital. And just the closeness and emotional attachment between the staff and providers and physicians. I think we're a lot more in tune to the people around us, how they're doing, how they're feeling, what's their emotional status. And that's, I mean, I've always thought about that before, but I didn't think about it back then as much as I do now. And those are probably the biggest things that I can see. Yeah.
Definitely going to, I think, impact mental health, and not just of healthcare workers. So we've already seen it in, unfortunately, in pediatrics and adolescents, just that the anxiety of the whole thing and the social isolation, it's been really detrimental. But certainly the people that were the front lines will deal with some of that for a long time.
I think it's really helped us, you know, moving forward. We talk about, you know, healthcare and what it's going to look like. You know, our position here at St. Bernard's is it's a system approach, and really what we ended up realizing during COVID was, you know, it's not just about what we're doing here in Jonesboro, but it's what we're doing in, you know, Blytheville, Osceola. They think differently, but there's got to be some middle ground so that we're able to quickly make decisions when there's pandemics or natural disasters. So it's having that system mentality. And then a lot of things from a, you know, community standpoint, it's getting upstream and how do we get to patients before they get to the hospital. It's the preventative medicine. When we start talking about the ACO and different things, it's your annual wellness checks. How do we take care of those things so that when you do get into the hospital, you're that much better so that we can get you, you know, in and out.
I agree with Dr. Howard and Vincent. I believe healthcare has always been innovative, but I think this has completely put a new spin on it. As we've mentioned in this discussion, all of the things that we brought in, but I think moving forward in the future when caring for patients, it will help us better plan for the future and anything that we may need.
Right. And I think it's changed our region, because I couldn't dare be on a panel like this and not say really good things about the hospitals outside of us that agreed to take patients as they were getting better, to offload us so we could get their sick patients in. And the camaraderie between Cross Ridge and Paragould, you know, it was just huge. And I really feel like that we've built really good relationships with them of trust, and I feel like that has changed our regional landscape, and I pray that persists, and I feel like it will.
Yeah.
Yeah, and from the long term, I think the demands on the supply chain, you'll see probably hospitals start to keep a little bit more of a stock on hand, at least for the foreseeable future, than what we have in the past, because we've been so used to getting what we need the next day.
Right.
And that's put a demand. You will probably start to see more manufacturing shift towards inside the United States, which unfortunately does create a higher cost towards that. So I think that is a potential that we can see from some of these outcomes from the last 2 years. We're already starting to see some of that happen now, but so that's some added things that we haven't already talked about.
Right. And I would echo what Emily said. I'm sort of excited about the innovation and how we've seen some of the red tape be torn down on the processes of getting, medicines approved and just expedited to get out to people. And I hope that will carry forward in everything we do, cancer treatments and all sorts of other treatments.
Yeah, I was going to say that is one thing with how quickly those vaccines came to market was unheard of
right.
before the pandemic, and if that can be mimicked for life-saving treatments in the future, that is definitely something that would be great to see
right.
moving forward.